makes a difference. So it is not very stable situation unless it is codified. Come, please come, late comers, come. So it is codified, it is always a problem. And one court interprets in its own way, another court will interpret it in its own way. That many times you get relief when you approach to the court, but many times you don't get, because they say where is the right, and government comes that huge expenses are involved, we cannot do, we don't have a money. But with this background, I will just discuss with you, share with you 2-3 cases. One case was very interesting. You know, rare diseases. Have you heard rare disease? There are about 800 rare diseases in the world, and treatment is only available 6, 7, 8 diseases, and that is very, very costly. Very, very costly. Means 3 crores in a year, 1 crore in a year, 6 lakhs, 7 lakhs per month treatment cost. Is it possible to give for anybody in this country? We got one case. What has happened? Very, very interesting story. A rickshaw puller, Sirajuddin is his name, and he had 5 children. 4 died of disease that is called Gaucher, MPS 1. Gaucher is the nickname of the disease. 4 already died because treatment was not given. Now the last child, that is Muhammad Ahmed, he was 7 or 8 years old, and this is story of 2013. He went to AIMS. AIMS gave him a certificate that treatment cost is 4.18. I am talking of 2013. Now we are in 22. 4.80 lakh per month lifelong. This was the certificate given to that patient father. And somebody told him that for this purpose you can approach Prime Minister office and they will help you financially. So that fellow, along with his child, went to Prime Minister office, and when he told and demanded that this is the situation, please help, because it is impossible. So what happened? He was literally weeping there, outside the office of the Prime Minister. One television person noted it and asked him why you are weeping. Then he told, my 4 children already died and this is the last one, and he will also die if treatment is not given. Then that media person gave my mobile number to him. He came to me. I saw that certificate, 4.80 lakh. It was almost impossible. People don't get even 10 rupee medicine here. People don't have money to travel from house to the hospital, and they die in the home itself because they don't have money to come to the hospital. What to talk of other treatment costs? So what is this? And it was a very, very new thing for me, but challenging also. Then I contacted one private hospital management and I asked them, what is this Gaucher? I wanted to know what is this. Then I went to the hospital, a group of 5-6 doctors met me, we discussed. They told me, Ashok, quality of life is not good, so many expenses, and it is painful. 3 things they told me. So I just dropped my idea to fight over this issue. But at the same time, since Delhi government was giving up to 5 lakh as a financial assistance for life-threatening disease. This is a life-threatening disease. So I suggested him to apply. He applied, Delhi government. And Delhi government, what did? They sent a check for 4.80 lakh to AIMS for his treatment. For 1 month, treatment was given. His weight was increased by 1 kilogram. Next month, AIMS said, bring money. He again went to the government office. They said, no, only 20,000 more we can give you because 5 lakh is the limit. So he stands nowhere. He again came to me. When he came to me again and he told me that his weight is increased and for 1 month the government has given. So it just clicked to me, I have to do something. Either do or die. If I will not do anything, the child will die. And once the government has given the money, then they should continue or they can stop it. And either they should have not given you. So once you have given, you should continue. So then I filed a case. Fortunately, the case came before a very good judge, Justice Manmohan. And Justice Manmohan said, when treatment is available, then we cannot see a child dying only for want of money. This is how a case started, 2013. In the first round, judge asked lawyers to collect money. The lawyers collected around 13 lakh rupees. And for 3 months, treatment went on for that. For 1 month, this Medanta, Gurgaon hospital, they provided 1 month treatment, free. And for another 3 months, this drug company gave free treatment for 3 months. This was 7, 8 months went on. Ultimately, we got a judgment from Delhi High Court that it is an obligation of the state to provide treatment, and government was directed to pay regularly for this treatment. This is all started from that, and thereafter we started filing case after case, and High Court also gave direction to the government to come up with the policy of treatment for rare diseases, because every day these children die. Maybe at the age of 5, maybe 7, 8, 19, 20. So there are lakhs rare diseases cases. Then what has happened? One patient from Employees State Insurance, you know, ESI Act. Yes. Employees State. There is an employees. There is a State Insurance Act. State Employees Insurance Act. State Employees Act. So this is Employees State Insurance Corporation. You might have seen the state ESI. Yes, your mother is registered.
Even they have quota underneath for the medical seat also.
This is ESI is very important. ESI Act, Employees State Insurance Act, ESI Act. So there are around 2.5 insured persons. They are all employees working in factories, hotels, shops.
Even private schools are
Yes, private schools are also included. So there are more than 2.5 crore insured persons, and if they include their families as who are beneficiaries, that goes our 13 crore population, 13 crore beneficiaries are there. This is very interesting, and for that some contribution is to be given by employee, and some contribution is given to the employer. Government is not funding that at all. And I will tell you, by this arrangement, about 4-5 years back, 3-4-5 years back, the ESIC had 15,000 crore rupees as surplus revenue. So the case came to us, and the problem was that 2014 ESI laid down guidelines for super specialty. This comes under super specialty treatment. So what they laid down is, they put a cap, 10 lakh per beneficiary per year. 10 lakh. It will not go even for 2 months treatment. Another is that if the child is born before the date of registration and is found to be suffering from this disease, then ESI will not give the treatment. You got the point? Registration. If the child is born, after, they will consider it with this 10 lakh cap. So ultimately, for rare disease cases, where cost of treatment is 1 crore a year, or in some like SMA, what is called yes, muscular dystrophy, and the cost is 3 crore even. So we filed a case challenging this. So again, the matter came before the same judge, and he said that ESI will provide the treatment, and we challenge those provisions. And then treatment started. It's very interesting. And one after one from Karnataka, Chennai, Jammu Kashmir, we start getting cases and filing and getting orders, and treatment started. And then because of court's intervention, they starting modifying all these guidelines. Around 3 to 4 times the guidelines were modified, and this child born before the registration, it was dropped. This 10 lakh was also dropped. They said we will consider from case to case. And then there was one more provision later on which they proposed to introduce, is that as far as the insured person is concerned, his treatment will be started within 6 months. Super specialty treatment will be started within 6 months from the date of registration. But as far as his dependents are concerned, their treatment will be started after a year of registration. So we also raised, what is this? It's a discrimination. How you can behave like this? So then High Court has quashed that provision. So now, from the day one of registration, every insured person as well as the beneficiary is entitled to get super specialty treatment legally. So, and one after one we filed cases, that as today I think more than 15 or 20 children, to over notice. Many must have approached directly to the ESI and must be getting, we don't know that, but at least 15 cases the ESI is spending on average of 1 crore per child per year. This they are spending it. This is what they are spending. So this is only possible when law is there. When law is there, so it is possible. But if you are not a ESI beneficiary, then there is no law. So there are hundreds and hundreds of other cases going on in the High Court because of direction by the High Court to frame a policy. They framed it. They framed it in 2018. Yes, they framed it, and they allocated 100 crore as a initial money, central government, in the policy. And then they suddenly withdrew that policy because we have not consulted states, therefore our decision was not correct. And they withdrew the policy. Then again court pulled them. Then they have come up with the policy, another policy. And then they laid down 15 lakh rupees was the cap for this medical expenditure. 15 lakh. What will happen? Then they were again pulled up. Now they have increased recently, about a month back, from 15 lakh to 50 lakh. They have agreed to that. But still 50 lakh is nothing. When there is an expenditure of 1 crore every year, lifelong, then what 50 lakh will do? So again court is pulling them, and we are going to challenge even that circular also, which putting a cap of 50 lakh. So what I want to tell you is because of this ESI Act, children's life is saved, and they are doing very well. And that Ahmad is also doing well. That child, initial child, very smart child, and is going to school and very good normal life is leading. It is a wonderful thing. One more thing I would like to share. One more case. That is what has happened in Delhi government. This typical government, very typical government. Interesting also. They had day one. These people have come. They had a problem, and they wanted that only in their hospitals. They are running about 36 hospitals. Delhi government running about 36 hospitals. So what they wanted that only those patients who are resident of Delhi and having a voter ID card of Delhi will be given treatment, none else. This is they were because when they came in the power, they called me, minister called me, and we discussed. So I got his mind where it is working. It is a little bit fight also at that time in me. How you can do it? Because I will come to that case where they wanted that only patients of Delhi should be given free treatment under private hospitals. There I pulled them like anything. How you can do it? But as far as these government hospitals are concerned, what has happened, 1st October 2018, there is one hospital, Guru Tegh Bahadur Hospital, GTB Hospital, Dilshad Garden, and there 8,000 OPD patients come every day, and out of that 8,000, nearly 4,000 belong to neighboring states. So they passed an order, decision on 1st October 2018. What they said, from this date, 1st October, no patient from outside will be given treatment. Number one. Number two, they will put 60 boards, big boards around the hospital, informing the people that from this date only residents of Delhi having a voter card will be given treatment. So on 1st October, somebody sent me from their own office, somebody sent me the order. I said, how it is possible? We prepared, 2nd October is holiday, we prepared a case on 2nd October, challenging validity of that. And 3rd October we filed the case. 4th October matter came before the bench, Chief Justice bench. Chief Justice told the Delhi government, how you can do it? They pulled them, but they did not change. They were very strict. No, sir, we will. 14th October, judgment came. This High Court quashed their order. And then all things restored. But this was official. But unofficially, they have given they have told their hospital managements to do it like this. So what they do is, if you are a resident of Delhi, how long one can fight like anything? If you are a resident of Delhi and some X-ray is required, okay, you will be sent to some private lab immediately and government will pay. But if you belong to a state other than Delhi, then you will be given 6 months date for X-ray or 12 months date for X-ray. What is this nonsense going on? So anyway, as far as that message has gone, that you cannot do it. So then what has happened later on in Corona period, they again come up with the same thing, and their cabinet, government cabinet, this minister's cabinet, passed an order that during this, because of this Corona, we cannot take a load of outside patient, and therefore from immediately government hospital will not provide treatment to patients from outside. I fought like anything, videos, this, how you can do it. Very interestingly, what has happened, that they passed the Disaster Management Act, this order. And in Disaster Management Act, Lieutenant Governor is the appellate authority. So in the morning 11 o'clock, they took a decision that this will happen. In the evening 7 o'clock, Lieutenant Governor set aside their decision, citing my judgment, my case judgment, set aside. So this is how, what is the, and Supreme Court in so many cases have said that once you approach to a government hospital or even to a private doctor, even and it is an emergency case, he is obliged to give all assistance free of cost at that time. And they have gone to say that if you don't have a bed, putting the patient on the floor, but you can't refuse admission. So this is second interesting, and now we are coming to third one. Third one is very interesting case. Central government, the government of India, in 1948 when Jawaharlal Nehru was there, they decided to provide land on concessional rates to charitable institutions like hospital, mandir, all these things, and hospitals and education institutions. The rate was very small, 2,000 rupees per acre cost. And from 50s, 60s, 70s, 80s, 90s, please stop talking. Please stop talking. Lands were allotted to these charitable institutions for educational institutions, hospitals, and religious purposes also. What has happened? Lands were allotted to the hospitals, and the condition was that you will provide 25% IPD free and 25% and 40% OPD free to patients belonging to economically weaker sections. They have taken the land. Those who have taken land, they were knowing that we will not going to implement it. Those who have given land, they forget everything after giving land. So it was, though sometimes it came in Parliament, questioned Parliament and also in Assembly that lands have been given and they are not providing, but nothing happened. I got information, authentic information in another case about some hospitals who were given land and allotment letters. There were three types of allotment letters. One allotment letter was containing that you have to provide 25% IPD and 40% OPD free of cost. One is silent. One type of allotment letter was silent. And the third one was that government will decide. These are three types of, I don't know who is architect of all this. But anyway, the point was that despite having land on concessional rate, public land on concessional rate, they were not providing any type of free treatment to anybody. So I went to the court, it was 2002, yes. 15 November 2002, I got a first order which says that it is an obligation of these schools, these hospitals to provide treatment. But at that time, I had only list of 11 or 12 hospitals only. But there were many more hospitals, so nobody was knowing. Then High Court appointed a special committee to investigate as to how many hospitals have been given land and what is happening. Then they submitted a report that there are 56 hospitals given land and 23 have a condition and 18 are functioning. 23 have a condition for free treatment and 18 are functioning. But none of the hospital is given. Then High Court appointed a committee, I was also a member. We started visiting the hospitals and pulling them, you have to provide, this is a High Court order. I know there is one hospital, Brahmshila Hospital, and there was a lady director, and when a team of over 4 or 5 people, three are lawyers, one is doctor from Delhi government, one maybe more. 5-6 people went. So he was just to catch my this neck. Why you have done it? You have. So she was so loudly speaking started. I said, Madam, please cool. I think, so your heart will be fail. You are a doctor, but please cool. I know she cannot do anything for us. So this is so much. They have taken land almost free of cost. And when the obligation comes to be implemented, this so then it was started from 2002-3. It's all started, and as today you see, we have 61 hospitals, 61 private hospitals, where over 950 free beds. And I used to go to different states, of course, primarily for right to education discussion, but when I told them that Delhi has a free beds, vacant beds, please come, we'll get you treated. People from so many places, and they forget that to education. They are all interested in their treatment, and they started coming, and all free, all free treatment, and for all diseases, whatever paying patient is taking, they are supposed to provide all. So this was really a wonderful thing happened, or it is practical. Even before COVID, there was occupancy was 85, about 85% occupancy. During COVID, it gone down like anything, but still 50% occupancy is still there, because of some lethargy on the part of government. The occupancy has gone down, but it is functioning. So it is a wonderful exercise. Anybody from any part of the country can come. And what is the eligibility? Eligibility is the minimum wages for unskilled worker of Delhi. That is the eligibility. Today, there is a minimum wage is 16,500 crore. 16,500 crore would be per month unskilled. So a family having this income, up to this income, they are entitled, and they can come from any part of the country. Even foreigner can avail. In one case, what has happened, Chin refugee has a heart problem. It is about 4-5 years back. So I sent him to the Max Saket, and then Max Saket refused him that you are not a Indian citizen, you are a foreigner. So then he came, he told me that he is refusing. Then I raised this issue, and then in the evening, management called me and said, then I got issued an official letter from the government of Delhi that anybody, including foreigners, anybody, those who are on our land, but their income is, eligibility is there, so they have to be provided. Thereafter, hundreds of foreigners took the treatment, because this refugees particularly, Chin refugees, there are about 5,000, more than 5,000 in Delhi, Chin refugees, and they have generally delivery problems. So they are living nearby Janakpuri. So there is one hospital, Mata Charan Devi Hospital, that is also in this list. So I used to send all those to there. So I think up to this day, in the past, I think more than 2,000 deliveries they did for the Chin refugees. So this is very interesting. A poor person from slum goes to a 5-star hospital and is well treated. I may tell you, you may be thinking that they may not be well treated, but they are well treated. Hardly any complaint comes to us as far as treatment is concerned. And the most interesting thing is that they are treated in a similar way. The nurse will come, madam, sir, and they will get the food like on the bed itself. So they feel world is changed. World is changed. And then we also told hospitals to provide their bill, but payable zero. So sometimes it is 70 lakh, 80 lakh, exceeding 1 crore if some EWS patient is on ventilator for 2 months, and the bill may be 1 crore only, but he has got to pay. What has happened? First of all, very critical patients are well treated, got well and went back to their villages with the bill. So they really got bad. So they are mad, and they will tell everybody, I went to this hospital and stayed there, I was treated like this is the bill of 20 lakh. So people start coming from every part of India for this treatment. But there is only bed are limited, this is all limited. But now the situation is that every hospital has 200 waiting list for surgeries, EWS patients. So much everybody wants to go there. So point is that, of course, very good. They are under obligation, they must do, and our people are entitled to. But question is that they have limitations. Beyond limitation, you can't ask. Like cancer patient, we have only one hospital functioning, which has only 10 free beds. Patients are in thousands. So even if they start treating, many times when chemotherapy is to be done, bed is required, and for some tests also bed is required. When bed is occupied, they are only obliged to provide 10 beds out of 110%. But now it has been decided, though in the letters it was written 25% and 40%, 25% IPD and 40% OPD. But ultimately it was settled that every hospital, whether allotment letter contains a condition or not, they are obliged to provide 10% IPD and 25% OPD, all free of cost. All free of cost. Walk-in free, walk-out free. So this is a position. The point is that they have limitations. So ultimately you are dependent on public health system, and in Corona period we all have seen that what has happened with the public health system, and how the private hospitals have treated and behaved. They have milked money like anything during Corona period, I will tell you. Milked it. So what we have learned, that you can't depend upon private system. You have to have a robust government health system, quality health system. So that is required, and for that purpose, I will be concluding 5 minutes. For that purpose, we need a robust law of public health. And how it can happen? It can only happen when state subject, this health subject, is brought into the concurrent list. A fundamental right is incorporated in the constitution, and a national law is made. Somebody asked me why national law is required. National law is required because that will mandate every state in the country that within such and such time you will have to have this minimum infrastructure, faculty, this, so that people of that state need not to move to the other states. Have you gone to any of you AIMS? Have you seen outside the AIMS one patient from Bihar along with him 20 people from his family are living with him outside and for years together. And this is not one family, hundreds and hundreds of families. People, charity, by way of charity arrange for their lunch, for their breakfast. So many, all melas are going on there. And even government hospital ask for money. Implants, they don't provide. They don't provide. There was one case where a boy of 30 years had a blood cancer patient was admitted in hospital, and AIMS told them to pay 3 lakh or 4 lakh. They arranged. His father was a police constable in UP. They arranged. He had no money in his bank account. It was small. And then after some time, AIMS started asking them to pay 6 lakhs more additionally. They had no money. They came to me. I filed a petition before a vacation judge in High Court. And very interestingly, the Judge said, वो the aims, council for the aims opposed that petition, that we can't do it. The judge बोलता है very interestingly, why don't you understand? He has appealed us. He has appealed us, and we have to help him. He passed an order, provide free treatment, and then free treatment was given. He was okay and went to the house. तो कहता भाई तुम समझते क्यों नहीं हो? हैं? इसने मुझको अपील किया है, हाई कोर्ट को अपील किया है, अपील सुनना पड़ेगा. So many things, but these are few things I wanted to share on this. I think.
But we are